The mild form of COVID-19 infections in Sarawak is set to reflect the nation's shift towards an endemic phase of the pandemic as the country achieves herd immunity, says Khairy Jamaluddin. The health minister said Sarawak was a good example that needed further study as it had already reached 80% herd immunity. Though positive cases were high in Sarawak on Monday, almost all patients were showing no or very mild symptoms. Only 4 of the 3,714 cases recorded were serious. We have looked into it, 99% of Sarawak's cases are mild or asymptomatic, he said after witnessing the single-dose CanSino vaccination drive for islanders in Pulau Larapan in Semporna on Tuesday. He found awareness of vaccination against COVID-19 was high among the people there, despite them living far from the mainland. This shows that communication is good, as village chiefs have played their part well in getting the message across, he said. He said his ministry was hoping to use the single-dose CanSino for people on islands as well as those in the interior. A total of 16,000 doses of CanSino would be sent to Semporna, he added. Khairy said with Sarawak achieving herd immunity, it was clear that those who tested positive only had mild infections. Even if there are a lot of cases, and the majority are mild, then it's not too bad, he said, adding that the authorities would study the Sarawak situation and also the effects of variants of concern such as Delta. Khairy indicated that Sarawak was facing similar issues as in England where herd immunity was achieved but COVID-19 cases continued to be high and were mostly with mild symptoms. Khairy also said the general policy of the government was to vaccinate everyone in the country whether they have an identification document or not. No one will be safe until everyone is safe, he said.